Good morning, all. And thank you so much, Morgan, for helping to pull this all together, and to my whole team. Thank you, everyone, for joining today. For those of you who've never met me, I'm Congresswoman Becca Balint, and one of the most important parts of my job is helping Vermonters and making sure that we can help you navigate the programs and the policies that impact your daily lives. Now, before we get into the program today, I just want to make one thing clear. We know that too many millions of Americans are concerned about healthcare costs. In fact, was looking at some data this morning in my first meeting of the day. It is the most important issue for a majority of voters right now because it ties into the issues of costs as well as health and safety. Americans want access to affordable health care, and they know they don't have that right now. It's not affordable, and they want their health care protected. And so it's important in this moment that you know that I'm standing up for health care that is available, affordable, and accessible to every single American. And of course, most particularly, I care so much about Vermonters, especially in the most rural corners of our state. Unfortunately, right now, we have an administration and my Republican colleagues that wanted us to shut down the government instead of meeting with us to come to an agreement on extending the Affordable Care Act subsidies. That's what this shutdown is about. We wanted to extend the subsidies. They don't want to do that. We have to hold the line on this. We know come November 1st, people across the country are going to see, in many cases, double-digit increases in their premiums for people who get their health care through Marketplace. And this affects all of us, whether you're in the Marketplace or not. And we cannot accept it. We can't bear the costs, and our healthcare system in Vermont isn't going to be able to backfill those cuts, both to Medicaid and to the ACA subsidies. So I am working every day alongside my team in DC to protect those subsidies. And I know a lot of people had a question about Medicare Advantage and why are we here today? Why do we have to have this webinar? And what I want you to understand is starting January 2026, there's going to be a dramatic reduction in the number of Medicare Advantage plans available to Vermonters. And I want you to know that I, as a member of Congress, I can't control that. Unfortunately, what I can control is getting you the information you need. So if you are a Medicare Advantage member, you are going to need to make a decision about your insurance to avoid penalties that you may not even know exist and ensure that you experience no lapse in coverage. We don't want anyone to go without coverage. So I am grateful today to be joined by representatives from AARP and the Vermont State Health Insurance Program and area agencies on aging, who will be presenting with you the best information that they have made available, and they will answer your questions about Medicare options. Now, it's my pleasure to welcome and turn it over to Andrew Sholnick, Government Affairs Director at AARP, and Sam Carlton, Director of the Vermont State Health Insurance Program and Resource Navigation at AgeWell. Andrew represents AARP's members and all older Americans before Congress, and he's also the executive branch on Medicare issues. Excuse me. He represents members to advocate for them before Congress and the executive branch. Andrew has over 20 years of experience in health policy. He appears regularly on AARP's town halls and webinars, and he's terrific at educating the public about all things Medicare related. Sam provides strategic leadership and oversight for programs that assist older Vermonters and their caregivers in accessing Medicare counseling, benefits coordination, and essential community resources. And as a lifelong Vermonter, Sam is deeply committed to helping individuals remain supported, informed, and independent as you all age in your communities. I hope the information that Andrew and Sam provide today can help you navigate the change and uncertainty. And I will keep on fighting for you in Washington for affordable and accessible healthcare for all. Now, unfortunately, I have another commitment that I have to attend, but please know that my team is on the call. We'll be sharing our contact information you at the end, and do not hesitate to call my office for any help in navigating questions about Medicare or Medicare Advantage. My team is an incredibly committed group of people who understand that their most important job is serving the people of Vermont. So I'm very happy that we were able to pull this together today, and without any more delay, let's turn it over to our presenters who are going to take you through what you need to know. And everybody, take care of yourselves and each other. Okay, Andrew.
Good morning. Thank you very much, Congresswoman. Happy to be here. First, I'd like to just take a moment to remind people about AARP. If you can advance to the slide, the next one. Perfect. AARP is a national organization. We have offices in all 50 states, the District of Columbia, the Virgin Islands, as well as Puerto Rico. We have a fully staffed, full-time employee office in Burlington, Vermont. We certainly hope you visit us or come check us out or see what programs are going on in your community. We have over 38 million members nationwide, about 110,000 of them are in Vermont, and we are committed to just working on the ground in the community with older Americans to help them age as best they can in ways that they want. And a large part of that is Medicare. What we do for Medicare is advocate on behalf of the program and to make sure that people get the care and benefits that they've worked for and earned and put their lives into. So with that, if we can advance to the next slide, I just briefly describe Medicare, kind of give an overview of Medicare and its many parts. Because often we talk about Medicare as if it's one thing, but really it's a lot of different components that work together. And it's helpful to know what each part does separately and then understand how they interact together. So what most people are familiar with is Medicare Part A, which is the hospital insurance. And this coverage covers your inpatient hospital stays. Medicare Part B covers your outpatient care, which is every time you visit a doctor's office, as well as some other medical equipment and things that happen outside the hospital. Now, collectively, Part A and Part B are usually referred to as original Medicare or traditional Medicare. And this is different from Part C, which is Medicare offered through private payers and private insurance plans that kind of bundle A and B together. There's also Medicare Part D, which is prescription drug coverage. And if you have original Medicare, you can purchase a Medicare Part D plan to cover your prescription drugs. Most Medicare Advantage plans include Part D coverage as well. Now, on top of Medicare, you also have other programs that interact. I want to draw your attention to just a few of them. Most may have maybe heard of Medigap, which is supplemental coverage. Medigap is additional coverage that people with original Medicare can buy to help pay for certain out-of-pocket costs, and that I'll get into in a second. But this is extra coverage you buy on top of your original Medicare from private insurance companies. There's also the Medicare savings programs, which are state-run programs that help lower-income individuals and middle-income individuals pay for healthcare expenses by covering premiums and out-of-pocket costs. There's also Medicaid, which is also operated by the state through a federal-state partnership. And people can be eligible for both Medicare and Medicaid depending on their income and asset levels. And then finally, there's Social Security. And it's important to understand that the Social Security Administration actually manages the enrollment process for Medicare and helps determine the amount of premium you'll be paying in the coming year. So all these components kind of work together, but when we talk about Medicare, we can often be talking about different things, which can get confusing. So we can advance to the next slide, please. Often the first question everybody has is, well, how much does Medicare cost? And again, this can be a little tricky because it depends on which part of Medicare you're referring to. So Medicare Part A, again, that's the hospital insurance and inpatient care, typically does not have a premium. This is because people have been paying into it through payroll taxes their entire working careers. And as long as you've contributed for 40 quarters or about 10 years of federal income tax, you do not have to pay a premium. Now, there is a deductible associated with Part A, and the deductible is the amount that you pay out of pocket before the insurance coverage kicks in. And in 2025, this deductible was $1,676 per hospital stay. So if unfortunately you happen to have multiple inpatient stays in a hospital during the year, the deductible amount restarts every time you enter the hospital. Part B is different. Again, Part B is your outpatient care. So every time you go to the doctor's office or see somebody that's not in, even if they're in a hospital physically, if you are not admitted to the hospital and spend the night, it's still Part B. And the premium for that in next year, 2026, is expected to be about $206.50. Official premiums have not been announced yet. We're expecting them any day now, but the estimate right now is it's going to be $206.50 a month. That's the standard premium. If you happen to have an individual income of over $106,000, that amount might go up depending on your income level. But most Americans on Medicare pay that standard premium amount. Now, in addition to the premium, there is a deductible in Part B, which is expected to be $288 next year. Again, that's the amount you pay before the coverage kicks in. And once Medicare Part B kicks in, Medicare will pay 80% of the charge, and you are responsible for 20%. Part C, which is Medicare Advantage, those costs can vary. Medicare Advantage plans have the ability to change their cost sharing. Typically, you still pay the standard premium amount, but the deductible may be different and the co-insurance amounts may be different. They also have the opportunity to charge a little bit more premium, and that's intended to go to extra benefits that they're allowed to provide. Sometimes MA plans provide dental or hearing or vision coverage. Sometimes they offer nutrition services. It's up to the plan to decide what they want to offer and to what extent. Part D costs also vary depending on the plan. Again, those are private insurance companies offering insurance coverage for prescription drugs. And those costs depend on the formulary, which is the type of drug that's covered, as well as the relationships with pharmacies. So what you pay in one plan may be different than what you pay in a different drug plan. Now, I want to revisit that Part B 20% coinsurance amount, because this is where Medigap supplemental coverage comes in. If you have original Medicare, you are eligible to buy a Medigap supplemental coverage policy. And Medigap is intended to pay for those out-of-pocket costs that could add up over the course of a year. In Medigap, you pay a monthly premium, but then that policy will take care of the 20% coinsurance and some other costs associated with Medicare. It does not offer additional coverage. It doesn't pay for extra benefits. It only covers what Medicare covers, but helps with those unpredictable out-of-pocket costs. Again, if you need help paying for healthcare costs and Medicare costs, those programs I mentioned before come into play. The Medicare savings programs, the Extra Help program, which is for prescription drugs, as well as Medicaid can be available to you. And definitely recommend contacting Sam at the SHIP office or reaching out to the state Medicaid office to see if you're eligible for help. Next slide, please. So what do we do during open enrollment? Again, open enrollment is happening right now. It runs every year from October 15th through December 7th. And open enrollment is really meant for people who already have Medicare and are considering making a change. Even if you like what you have and you don't want to make a change, that's fine. You don't have to do anything. But it is still a good time to look at your coverage, look at what your health needs are, what you think they might be in the future, and see what options are available to you. During open enrollment, you can change from original Medicare to Medicare Advantage. You can change from Medicare Advantage to original Medicare. You can change from one Medicare Advantage plan to another Medicare Advantage plan, and you can change your Part D prescription drug coverage during this time. And the coverage changes will take effect January 1st, 2026 for your next plan year. Now, you cannot add Medigap to or a Part D plan to Medicare Advantage. Those are meant only for original Medicare. And if you leave original Medicare and have Medigap, you may have trouble getting that back. Medigap is also, their enrollment period for it is slightly different than regular Medicare. You're encouraged to enroll in Medigap when you first become eligible for Medicare. If you chose Medicare Advantage first before original and are now switching back to original, there might be difficulty getting a Medigap plan, or the cost might change. It really depends on the company offering it. But during this time, again, October 15th through December 7th, you should make a list of the doctors that you see or may want to see in the coming year. You should also make a list of the prescription drugs you take, and as well as think about a preferred pharmacy that you have. If there's one down the street that you go to all the time, you want to make sure that they have a relationship with the Part D prescription drug plan that you sign up for or the MA plan that you sign up for, because costs can be different from pharmacy to pharmacy. So that's the overview of open enrollment and Medicare. I'm happy to turn it back to Morgan and look forward to questions coming down.
Thank you so much, Andrew. We really appreciate all of your support. I just want to reiterate that if you have a question, please go ahead and put it in the Q&A function of Zoom. And additionally, just want to share that this is being recorded. We're going to share a copy and a link to this recording along with the presentation slides to everyone who registered for this call, and answer some of the questions that were brought up in the call. So now I'm going to turn it over to Sam Carlton. Sam, take it away. Thank you so much.
Great. Thank you, Morgan. And thank you, Congresswoman Balint and team for having us on here. I'm excited to have this opportunity to reach as many folks as possible as this is a very confusing time for folks. So my name is Sam Carlton. I am the statewide SHIP director. SHIP is an acronym for the State Health Insurance Assistance Program. SHIP is a federal grant that we receive to help folks navigate Medicare, either with one-on-one counseling or in classes. So that's one of the hats I wear. The other hat I wear is as the Director of Resource Navigation at AgeWell. AgeWell is one of the 5 area agency on agings in Vermont. So there's sort of one in each corner of the state. There's the NEK Council on Aging in the Northeast Kingdom, the Central Vermont Council on Aging in the central part of the state, Senior Solutions in southeastern Vermont, and the Southwestern Vermont Council on Aging in Rutland and Bennington counties. So your local SHIP office is housed at your local area agency on aging. So that's going to be the best way for you to contact someone for assistance with these services. Now, I should also, before we get into it, I do want to just let it be clear that unfortunately, due to demand, all of the local SHIP offices are booked through open enrollment, so we are not able to support folks with one-on-one counseling at this time. Post open enrollment, we will be able to. So for one-on-one support, we do recommend you call 1-800-MEDICARE directly, or use the Medicare Plan Finder, which I'll go into in a few minutes to sort of help you navigate some of this stuff on your own. So this slide here is just describing AgeWell's mission to support older Vermonters as they age, and to inspire aging with confidence. So as I mentioned, the State Health Insurance Assistance Program is a federal grant that we get, housed at your local area agency on agings. I will also mention that while we are unable to do the one-on-one counseling right now, we are offering statewide webinars. On November 12th from 12 to 1, we are offering a Medigap specific webinar, and on the 19th of November, we are going through a more in-depth Medicare 101 just to help people understand the nuts and bolts of Medicare who may have been on the Advantage plan covering most things. So if you do want to sign up for one of those classes, please call the helpline. If you just want to go back to that last slide real quick. The helpline number at 800-642-5119, and we can get you signed up for those webinars, as well as if you have general questions, your helpline is going to be your best way to get those answered as well. So now next slide, please. So this is a slide, Andrew touched on this. Andrew touched on a lot of the things I had planned to touch on as well, but I think that's great. You guys are going to hear a similar message both times. This slide here sort of, I think, nicely describes the difference between the traditional Medicare, original Medicare, or the Medicare Advantage that we are losing, except for one Humana plan that covers 5 counties in the state. So the main difference here is that you were paying one private company. It was getting all of the things in one kit and caboodle. Whereas in the original Medicare, it is split into the parts. So Part A for hospitalization, Part B for medical, Part D for drug coverage. That's what you're required to have. Congresswoman Balint mentioned a potential penalty. Those are the things that you are absolutely required to have in order to avoid a penalty. So that does include drug coverage. Even if you don't take medications, you are still required to get a drug plan. Now, the other piece that you are not required to have, but would make sense to have is called the supplemental coverage, also called Medigap, Medicare Supplement. In general, Medicare covers 80%, so you're exposed to 20% if you do not have any additional coverage, and that is what the Medigap would be for. One thing I do want to point out about Medigap is it does not include dental, vision, or hearing. No gap plans cover that. They're not required to. So if you're interested in those, in that coverage, you would reach out to the companies that you kind of would think of, actually. VSP for vision, Delta Dental for dental. They offer private policies that you can get for those additional benefits. Next slide, please. So as Andrew mentioned, we are currently in the Medicare open enrollment period, and he did a great job of discussing the changes that you can make, why you would want to do that, and how that works. So you should have received an annual notice of change letter or an ANOC letter from either your drug plan or your Advantage plan, letting you know about changes in coverage. Obviously, the big one is if you were on the Blue Cross plan or the United Healthcare plan that left, they would be informing you of that. Other changes that they often will let you know is of specific drugs no longer being covered, premium costs, that sort of thing are all in that ANOC letter. And so you make these decisions now before December 7th, but so it can so you can have that when the new year rolls around. Now, I just want to point this out here. You should also have received an additional letter, which I have an example of further down the line, that outlines, it's a letter from CMS. So CMS, the Centers for Medicare and Medicaid, outlining that your coverage is lost and you have been granted what's called a special enrollment period. That special enrollment period goes 63 days from the end of your coverage. So 63 days after the 31st of December of this year for you to get either a Medigap plan or a Part D plan without facing a penalty or underwriting in the case of the Medigap plan. So that's an important letter for you to look for and hold on to. Go ahead, next slide, please. So this is just an example of a Part D card. We put these on here just so folks sort of understand what they have. If you've had the same plan for year after year, as Andrew mentioned, it can roll over. So it's easy to sort of forget or not understand what's in your wallet. So the Part D plan has the S number on that bottom right corner. They always start with the letter S, and then the plan ID will tell you, one, that it is a prescription drug plan, and then which plan it is. So Part D does work with original Medicare. It coverages your prescriptions. You pay the premium, the deductible, and any copays or co-insurance as the plan needs. So this is the thing you want to review year in, year out, to review costs, tiers, restrictions on drugs, and whether or not your pharmacy is in network or preferred. Go ahead, next slide. Won't touch on this one as much because as we know, there's only that one plan left in Vermont. The Medicare Advantage plans, again, bundled all of it into one, could include extra benefits, dental, vision, hearing, gym memberships. There was always transportation, sometimes meals, depending on the plan. You would pay a premium, although not necessarily. Some of them had no monthly premium. Deductibles, copays, co-insurances. There were issues with Advantage plans related to prior auths, provider network, things related to that. I will note that the Advantage plan that remains in Vermont is a Humana plan in Bennington, Caledonia, Essex, Orange, Windham, and Windsor counties. I will put a huge asterisk with those, though. The Humana network doesn't cover a lot of large medical providers in your areas. So if you have questions about that, the only way to get that information is from Humana directly in terms of what their network coverage is. So I'll throw that out there. Yeah, next slide, please. So drug costs with Part D and Medicare Advantage plans do vary depending on the plan's formulary, what tier the medication is, what benefit phase you are in, whether it's the deductible, initial coverage, or catastrophic phase. In 2026, the Part D out-of-pocket cost for prescriptions will be capped at $2,100, which is a good thing. Also depends on what pharmacy you use or if you do receive either extra help or VFarm. So next slide, please. So Andrew touched on these as well, and thank you for doing that, Andrew. So there are actually three. So here are two listed that are related to covering your prescription drug costs. So that is going to be the federal assistance, the low-income subsidy, also called LIS or extra help. People use those all very interchangeably. So as you're sort of looking into if you're eligible, know that that's the same program. And what that does is it pays for your monthly premium on your drug plan, and it lowers your copays. So usually your copays are $1 or $2, similarly to VFarm, as we'll see in a second. So which list eligible plans? You can find that in the back of your Medicare and You handbook. And you can also get more information about that at ssa.gov. Similarly, there is a state pharmacy assistance program. So if you're not eligible for the low-income subsidy, you may be eligible for VFarm. And if you are, you would pay a monthly premium paid to the state. And the prescription copays are reduced to about $1 to $2. So there's that link to the Department of Vermont Health Access there that describes eligibility and where you can get the application. There is additionally the Medicare Savings Program, as Andrew mentioned, and what the Medicare Savings Program does. It can do many things, but the big one that it does is it helps keep your Part B premium in your Social Security check, which would be beneficial for folks who I think are going to likely want to be purchasing a Medigap plan. So it could help, sort of support that in your month-to-month costs. If you have questions about eligibility about this is another just plug for your helpline at your area agency on aging. Our helpline staff can certainly help you understand eligibility, get you applications, and help you apply as needed. Next slide, please. All right, so how to change coverage. You complete a plan comparison using Medicare.gov. And I'll walk through that in a few minutes. Oh, you just want to run back, sorry. On Medicare.gov, you can help you compare your prescription costs right there. You can create a login so it saves year to year, which is a good thing. Normally, you can call SHIP for referral to help you with this process. Again, this is an unprecedented demand. We've never had an open enrollment period in my 11 years doing this where we are no longer able to help folks in October. In a normal year, we are able to help folks at least through the end of November, early December, before the end of open enrollment. So I am very sorry that we are not going to be able to help you one-on-one this year, but outside of open enrollment, again, past December 7th, those who are going to use that special enrollment period, we can provide support with that. So that is a number you want to have. And again, in general, for questions, as you're looking for supports in your community, the helpline is the way to go. But at this time, if you're looking for one-on-one counseling, 1-800-Medicare is the way to go. They are open 24/7, and they can help you do these comparisons and do this work for you. I should also note that both Medicare.gov and 1-800-Medicare are not impacted by the shutdown and are both functioning as normal. Next slide, please. So the Medicare and You handbook, you all should receive this year in, year out. It has a lot of great information in it. One of my SHIP coordinators, Sharon, she likes to wave this around like a Bible. And it's all marked up and earmarked with information. So great resource just to really understand Medicare in general. And in the back of the Medicare and You handbook has all of the Vermont plans for the year 2026. So that's another way you can sort of compare coverage as you're looking into this. So a good resource, something that you want to keep handy year in, year out. So next slide, please. And so this is an example of what it looks like in the back of your Medicare and You handbook in terms of the drug plans. So you'll see here it goes over the costs, the rating of the plan. The star ratings are not, unfortunately, incredibly trustworthy. I don't know why that is, but that's kind of the case. It also tells you how you can enroll. So you can enroll by going to that website or by calling the phone number there. Does also have, you'll see that, as I mentioned before, it does have that S number with the plan ID. So that's how you'll know which plan you're talking about. Next slide, please. Again, here's the two Advantage plans that are in Vermont this year, these two Humana plans. And again, if you're looking for plan information, you would need to call them. That's really the only way to know about, again, the network coverage. And again, I would just, if you're interested in these plans, I would very strongly recommend you do that research. Next slide, please. And so this is the Medicare.gov, the plan finder. As I mentioned, we're gonna walk through this. This is how you create an account, and I would strongly recommend you do create an account. Medicare at this point really kind of wants you to. I'm going to show you how you can do a generic search in a moment where you don't need to create an account. But if you create an account, you'll be able to save it year in, year out, and it just makes it a little cleaner and quicker as you go through this process. It also will be easier if you are on VFarmer lists to understand how your benefits are impacting the cost of the plans. Next slide, please. All right, so and again, using the Medicare Plan Finder, you can do the generic search, which I'll show you how to do in a moment. For both gap and drug plans, you can see Medigap information on the Plan Finder as well, which is really helpful. And yeah, so if you do create an account, you'll have your plan history. It'll show all of your insurances. It'll show your statements as well, which I think is great and helpful, you know, if you have questions about your healthcare as the year progresses. Next slide, please. So this is what they look like, the drug plans on the plan finder. And again, we'll go through this in a moment. It's got your monthly premium, your deductible, you know, the total drug cost for the year. Next slide, please. And again, the Advantage plan, this is what it says. You'll notice, you just want to sit back there. You'll notice it doesn't mention the network. So it will tell you that there's 0 monthly premium, total drug costs, other costs throughout the year, in and out of network costs, but it doesn't, again, list the network itself. Next slide, please. And here's an example of that letter from CMS. This is the one that you'll notice on the bottom it says keep this letter. It's proof that you have a special right to buy a Medigap policy or join a Medicare plan. So this is important that you keep this letter when you get it. The annual notice of change letter from the Blue Cross and Blue Shield and United Healthcare Advantage plans should also work in terms of proving that you get a special enrollment period. But this letter specifically is the one that you really want to hold on to for that purpose. All right, and I think these are just some resources as well related to healthcare. So again, your SHIP is your local office. That's got AgeWell as I'm sitting in AgeWell today. The Senior Medicare Patrol is a partner grant to SHIP. Senior Medicare Patrol works to prevent Medicare fraud. So for some reason you feel you have been exposed to fraud or feel like there's something shady going on, SMP is your resource for that. Healthcare Advocate at Legal Aid is a great resource with healthcare questions as you have them. Medicare New Handbooks right there, Medicare.gov. 1-800-MEDICARE, as I mentioned, as a resource. Medicare TTY service for hearing impaired, the number's there. Social Security number, and the Department of Vermont Health Access. The bottom number is the Vermont Department of Financial Regulation. This is an important one. DFR, they're the body that regulates insurance in Vermont. So they're the ones who have the information about the Medigap plans in terms of costs, and those are located on the DFR website. And I will show you actually where that lives on the Medicare Plan Finder as well to sort of maybe expedite the process for you a little bit. But DFR is really the resource related to Medigap questions, you know, as you navigate this change you're experiencing. All right, I think at this point, I'm going to go ahead and share my screen. And hopefully you're all seeing the Medicare Plan Finder. And hang on, I just got to drag this out of the way. Okay, so here is the Medicare Plan Finder. So the address is medicare.gov. And so you'll notice it does say here it's open enrollment now to December 7th. So a couple ways to navigate this. Again, I would encourage you to log in and create an account. It really is going to be in your best interest moving forward. But if you don't want to do that, that's fine. You can access information one of two ways: find plans here or here health and drug plans. So I'll just do health and drug plans real quick. And it lists the various components of Medicare that you can look for. It talks about how Medicare works with other coverage. A lot of the stuff Andrew and I talked about. I'm going to go to Medigap first because I didn't touch much on that in my presentation. So I just want to touch on this because again, I think a lot of people are going to need some support with this. So we'll just click there. Tells you what Medigap insurance is. That's not what I'm after. Okay, so I clicked the wrong thing. Hang on, bear with me. So if you go back to find plans, Here we go. So this is what I'm after. So I typed in Colchester. That's where I'm sitting today. So 05446, you'll type in your zip code. If you're new to Medicare in 2025, those who, may be turning 65 in November, December, you would need to select coverage for this year as well. So you would do 2025. That's why it's still there. So see how it's giving me this continue without logging in option. So we'll hit continue here. And this is what I was looking for. So next, select the type of plan you want. So we're going to do Medigap first. I'll show you what that looks like just so you can sort of see. This will give you a more accurate price if you put this information in your age range, your gender, whether you smoke. But we're going to skip that for now just so I can show you the sort of the differences in the plans. So there are 11 Medigap plans offered in your state. And I'm going to pull this up first. I think it'll make the most sense. So this is the Medigap Plan A. You'll see that premiums range from $129 to $567, depending on your age, sex, health status, and when you buy. Those with the special enrollment period will be able to get it at the lower rate. You will not be facing any underwriting because you have that special enrollment period. So that's an important thing to note. But what I wanted to show you is if you go here to compare to other plans, it's going to list all the Medigap plans in Vermont. So all the kinds of gap plans that there are here. So you'll see it's A through N. There are some caveats with that and what they cover. So in terms of coverage and cost, I know a lot of folks who are on the Advantage plans have been looking at N or G as options. So you'll see the things that don't cover A and B don't cover skilled nursing, doesn't cover the Part A deductible. And these are the decisions you'll be looking at as you go through. So I'll close that out. And let me just run through so you'll see that some of these plans, there are restrictions. So Plan C, this plan isn't available if you turn 65 on or after January 1, 2020. And that's going to be the case for several of these. Plan F, that's definitely the case. And Plan F high deductible. So I'm just going to run to this Plan G just so you can sort of see plan details, what it looks like. So monthly cost, premium $197.90, medical Part B deductible, and all of this information as well. And then you can view policies, and then it will tell you, it'll go through each insurance companies. And you can get a quote from the individual insurance companies. Now, I know the costs look kind of high on that one, and they are. So I will also look at the high deductible Plan G, which has a bit of a lower cost. As we look at policies, you'll see 50, 51, 52, 176, depending. And that's information you would get from the plan directly. So I also like to note that there are multiple insurance companies and policies within each plan. They cover the same thing. They have to cover the same thing. So you're sitting there wondering, why, Sam, would I pay $50 to United American when Bankers Life is charging me $121? Really, it's your call. It's your decision based on which insurance company perhaps you've had experience working with in the past, or whatever personal choice you make. So now I'm just going to run through how to do the plan comparison for drug coverage. So again, same spot. If we go back to Medicare.gov, you can either log in or go to Find Plans. With Find Plans, we'll do 2026. Again, I'm sitting in Colchester, so I'm picking 05446. Continue. I will do drug plan. And I'll find my plans. I'll say it asks if I receive any support with drug costs. I will say that I don't. And so, do you want to see your drug costs when you compare plans? I do. We're going to do yes there and hit next. And so then the way it works is you type in drugs that you might take. So maybe you take Plavix, and you'd hit add drugs. It's going to give you the option for generic or keep brand. I want to go with generic, and then it's going to come up with the most common dosage. So this is the most common dosage for this generic. So I'm going to add it to my drug list, and I'll add another drug. I'm going to add Eliquis. And again, most common dosage, you can change that to what you take. And I'll add to my drug lists. And then I'll be done adding drugs. Let's just say those are the two medications I take. So you hit done adding drugs. And then it's going to give you options for your pharmacy. It's going to pull up this map. There are a lot of pharmacies close to where I'm sitting. So I will do mail order. I would recommend you always do mail order for comparison. It's just helpful. I'll do Shaw's because it's right next door. And I'll do Costco because it's also pretty close. So continue to view plans. And it's going to pull up all the plans that cover my drugs and also have the best cost. So it'll tell you that two of my pharmacies are in network. It'll tell me that's my monthly premium. There's the total premium cost and the deductible. And then it gives you the option. So this is actually the cheapest plan this year. So this Humana Basic plan. So as I mentioned, you have to have a drug plan. So for folks who don't take any medications, this would be your the one you would go after. But you'll see it did actually cover the two drugs that I listed and the pharmacies for close to where I'm sitting. And you'll see there are other options as well. And so then, once you make your decision, again, I would probably go with that $8 one. It seemed like it was going to be covering what I needed. You would click enroll right here, and you can join the plan right from here. You can also call, again, with the 800 number listed in the book, or if I click on this plan, it gives me a little more information, and the 800 numbers there as well to call. All right. So I think that is all I had to share. So I think we have time for questions.
Thank you so much, Sam. I appreciate it. And Andrew. All right, let's start with some of the questions that we had coming through. Okay, what do we do if we did not save our discontinuation letters or letter from Medicare?
So your best bet would be to reach out to your insurer, to Blue Cross and Blue Shield or United, to have them resend that. And again, that will be sufficient to prove your special enrollment period.
Okay, great. Please clarify the deadlines for enrollment and who gets the special enrollment period and what
Yep.
special enrollment period applies to, example, Medicare, Medigap, Part D, etc.
Yep, absolutely. Great clarifying question. So if you were not losing your coverage, if you are just on a prescription D plan, and you just wanted to do your plan comparison for the year, that is December 7th. The deadline for that is December 7th. For those who lost their Advantage plan, so there's sort of two deadlines that I'll say. So you were granted the special enrollment period, the SEP, 63 days from the end of the year. So from the end of when your coverage ends. So that's the 31st of the year. If you don't make a decision prior to December 31st, you will not have drug coverage or gap coverage for 2026. So I would recommend making your decision before the end of the year. December 7th actually doesn't really impact people in that boat. They're going to need to pick a drug plan and a gap plan if they want to have that coverage by the first of the year before the end of the year. If they want to wait, they can wait. They have that 63-day window for both drug coverage and the gap coverage.
Okay. Thanks so much, Sam. I appreciate it. I have Medicare Advantage for 2025. There is no premium. If Congress doesn't extend the ACA after November 1st, will my coverage or expenses change for the remainder of 2025?
So that's a totally different issue, actually. So that's not related to Medicare at all. So if you're on a Medicare Advantage plan through the end of the year, you will not have a premium for November or December, same as always.
Okay, thanks for clarifying that. Can a veteran who uses VA medical not sign up for Part A and Part B? I already get my medical and prescriptions through the VA and don't want to pay the Medicare premiums.
Yep, that's fair. I depending on your circumstance, and I would check in with your with the VA because you could have TRICARE for life, and that works a little differently than like Champ VA or other insurances. So I would definitely encourage you to speak to your social worker or the office at the VA. But in general, you do have to enroll in Part A and Part B, but your drugs remain covered by the VA.
Amazing. Thanks.
And they do a great job. I will say the VA coverage for drugs is really good. They negotiate drug prices.
It's
Well,
also, just to add, if you seek care outside the VA, that's when you would need the Medicare coverage, because the VA doesn't extend beyond VA health centers, which is
That's
why
a great point. Yeah, absolutely. Thank you, Andrew. Yeah, especially in terms of like hospital, Part A for sure.
great, thank you. All right, the next question that we had. Will pre-existing conditions be considered when I'm switching to another Medicare Advantage plan or traditional Medicare?
it can for Medigap purposes, if you enroll late, if you decide to go original and get a Medigap plan, if you don't do it during that special enrollment period that Sam was talking about, you're subject to medical underwriting, which means that they can look at your health status and
Mhm.
pre-existing conditions and affect your premiums or coverage.
Okay. Sam, do you want to add anything to that?
Yeah, that's right. I think it's really important to note the special enrollment period is a really good thing for those who lost Advantage plans for this exact reason. So you can, in general, outside of the special enrollment period, you can either face under medical underwriting, or they don't have to sell you a policy. I mean, that's the other piece of it. So those who are in this boat, this is a good thing that you're getting this special enrollment period.
Okay, thanks. All right, next question. If I'm eligible for V-Farm, do I still need to purchase a Part D plan, or is V-Farm in place of a Part D policy?
So you do still need to get a plan, and so this, when you're doing the application, it asks which one you've picked, and so the way it works is VFarm pays the premium depending on your income. You pay a small premium to VFarm. It might be like $15 a month, and then so that's how it works. They pay the plan, you pay VFarm, but you do still pick a drug plan.
Okay, Andrew, anything else?
I'm not familiar with the Vermont program.
Okay.
Sorry.
Sure.
All right. Where can I get a hard copy of Medicare and You? I know you lifted that up, but let's just reiterate that one more time.
Yep. So you can either go to Medicare.gov and get it there, or request one there, or you can go to there's your local Social Security office should have it. Your local area agency on aging definitely has it. So one of those three places, just call and they can send you one. I can actually send you one if you need one.
If I'm moving from Medicare Advantage to traditional Medicare, do I need to do anything? Oops, sorry. With regard to Part A, or simply sign up for Medicare Supplement and Part D coverages?
This was a great question, and thank you for asking that. I noticed this was in the list of pre-questions. If you're in this boat, you are getting moved to traditional Medicare Part A and Part B as of January 1, regardless. So that's happening. The other pieces, getting the gap plan or the drug plan, are the actions you need to take.
And that's because when you first enrolled in Medicare during your initial enrollment period, when you turned 65 or became eligible, you were most likely already enrolled automatically in Part A and possibly Part B, depending on if you were collecting Social Security benefits. But in order to sign up for a Medicare Advantage plan, you have to physically enroll in A and B anyway. So what's happening is you're reverting back to original, essentially.
Yep. And if you need information about your Medicare number or the effective dates, I would reach out to Medicare directly, and they can provide you with that.
Okay, great. If I have a Medicare Advantage plan from another state, Humana, is my coverage affected by Humana's decision to discontinue in some counties in Vermont?
So if you are coming from another state on an Advantage plan, you're likely going to need to change anyway,
Okay.
because the networks for Advantage plans generally don't go state to state very easily. Unlike Gap plans, Gap plans are nationwide. So if you're moving to a new state, moving to Vermont on another Advantage plan, you're also getting a special enrollment period when you make that switch. So that's something I would again reach out to one under Medicare, and they can support you with that. You're likely going to need to make a change. If you're in one of those 5 counties, you could pick another Humana Advantage plan, but you likely will have to probably get a drug and a gap plan. I would say, depending on where you live.
Yeah, that's a key point, though. I should have spent a little bit more time on probably before. Medicare Advantage plans have provider networks that are typically based on your locality or county or region. Original Medicare does not have a provider network. You can technically see any Medicare provider in the country. So if you travel a lot where you spend half the year in a warmer climate and half the year in Vermont, you'd probably want original Medicare because your Medicare Advantage network wouldn't work outside your home base. You'd pay out-of-network prices. So you'd probably get care, but it would cost significantly more than if you were seeing an in-network provider.
Okay. I think this is a tangential question, but I'm kind of going the opposite direction. So I just want to make sure we cover it. I may need to move to another state, but may not know before December 7th if I may not be here in January. Do I enroll in Vermont anyway? I am already on Medicare.
Yeah, I would say you do if you're not sure. If you're moving, again, they generally grant special enrollment periods for folks who move. So what I would do is as it gets closer to that time, every state has a SHIP office. Sometimes they're called different things. They're called Shine in Massachusetts, for example. But it's the same federal grant to offer folks one-on-one counseling related to Medicare. So I would just do a little research into where you're moving to and maybe connect with that office as well.
Yeah, if you move, particularly if you move states, you do get that special enrollment period. So it's probably better to protect yourself, get insurance coverage now that you know you'll have. And if you need to change, you have that opportunity to change.
Great. We've saw this a few times on the Q&A. What is MedicareSupplement.com? They sent me an email saying they're preparing a quote for me. Can I trust this?
Absolutely not. I don't know what that is, but in general, .coms not necessarily trustworthy. So Medicare.gov is .gov. That's going to be trustworthy. Medicare also never emails. Medicare doesn't email. Medicare doesn't call. Medicare only sends you snail mail hard copies. So if you're getting something in your email that says it's Medicare, it is not. So do not trust it. If it feels real scammy and you think and you're worried about whether your information has been exposed, I would reach out to the Senior Medicare Patrol, SMP, that resource that I shared. They're the ones who investigate fraud related to Medicare.
Thank you so much for that, Sam. We know we get a lot of calls about this in our office, so we'll make sure we lift that up in our response email as well, especially during this time period. Next question. Is there an easy way to determine how good the customer service of a Medigap company or the financial stability of the company?
It's a great question, and I don't really know that I have a strong answer on that. I mean, I think DFR provides some information. You can certainly go to their website about insurance companies that work in Vermont. I think in general, if you know it's an insurance company that you've worked with in your working life or that's existed for a long time, you can certainly have some trust with it and the customer service. I mean, I can't really speak to one insurance company versus another. Unfortunately, that's really the grant's very specific about that. But yeah, I guess that would be my advice. Double check with DFR, the manufacturing regulation, and just sort of trust your gut. You know what I mean? I think most people have a good understanding of this, better than they give themselves credit for often.
Okay. Where can providers get information about these changes? How can we understand about where we fit in with in network versus out of network status and help our patients understand?
That's a great question.
Understand ourselves about the in network versus out of network status and help our patients understand. Sorry, I had to read that a couple times. I apologize.
Yeah, unfortunately, I think that's research you'd likely have to do on your own, much like your patients and Medicare beneficiaries.
Yeah.
The Medicare.gov is a really user-friendly website for a lot of this information, but for the Advantage plans, they don't often clearly list their network, so you do have to do a little bit of legwork on that. But in general, in terms of Medicare education, SHIP is happy to work with providers. We provide educational classes to hospitals, social workers, clinics throughout the state. So if that's something you're interested in, please reach out. I'll be happy to connect you to your local office.
Yeah, and if you're a healthcare provider, your insurance arrangements are managed typically through your hospital administrator, if you're affiliated with a hospital, or the medical group practice administrator. These are business contracts and arrangements done on a fairly regular basis. So you as a medical professional may not have been engaged in those negotiations, but your practice definitely has. So certainly start by just asking your practice who you participate in, so you're giving your clients and patients the correct information.
Okay. Sam and Andrew, thank you so much for all of your support. We are coming up on time here. We're going to launch the poll for all of the participants. Please let us know how this webinar served your needs, and let us know if there's room for improvement. Again, we'll be sending out a recording of this call along with the slides and kind of key information from today's call. We can't thank you enough for making yourselves available for today to support Vermonters, and thank you for all that you do.
Thank you for having me.
Thank you so much for having me as well.
Thanks, Sam. Thanks, Andrew.